so much, and I appreciate that we can collaborate together, because this is a multi-level task, and we need to collaborate if we should have success in the European plan of beating the cancer. And as it was said, the local and regional level is so important when it comes to try to get business in quotation about this, because we need to do things. And it's 19 out of the 27 member states. There, we have the responsibility on the local and regional level. So we are also a really important player in this, that we can stop cancer. And luckily, health has become a more important issue within the EU too, due to the corona, and we have more and more discussions about health. And I usually say that health is wealth. We must have a healthy population. And the first thing then to do is work with public health. And there we really need to work together. And I think the EU has done a great job when it comes to stop smoking. But we also need to reduce alcohol. We need to have active living and healthy living, to move much more. And there, when it comes to all these healthy lifestyles, we really need to work together, because it also has to do with clean environment, what we eat. I think decision makers need to put much more in prevention, because it's said that we can prevent cancer to 30 to 50%. That is prevention. So that must be discussed much more, so we will have a health awareness. And secondly, is of course screening. That is a really important tool that we can find cancer. And number 3 is giving vaccines. Also, for example, civic cancer, you can also, hepatitis, there you can have also the boys also get vaccination. And then we have, of course, knowledge. Knowledge is power. And we need to have more research and scientific work. Digitalization is also, of course, of importance. And then to share data, medical and scientific data. And that's why I'm very happy that the EU will have they plan now to have European health data space. And that will really boost the work of Europe's Beating Cancer Plan. And we need to share this knowledge, the experience and data, so we will have more practical solutions to benefit for the patients. And we know that for screening, we need to be more targeted and more effective and accessible. And I know also that EU will have taken initiative to have a knowledge center of cancer. It was set up as in 2020, and that was mentioned there with all the data you gave at the beginning. There we know now it's there, and we need to work with that also, because we know that it is really inequalities when it comes to cancer in Europe, and not only in Europe, also within the member states, different regions do have inequalities when it comes to cancer. The goal is, of course, that everyone, wherever we live, we should have the same right to specialist care, diagnosis, treatment, and equal access to medicine. But that is the goal. The road to this goes that we must work much more with the cross-border healthcare directive. We already have this, but we have to see what did it happen during the Corona time. It was almost easier to fly a patient to another member state than to work cross-border. So on the cross-border directive, we have to do a lot more, so it will be a practical way of dealing with cancer, for example. Also, every country needs to have this cancer center per member state. And I would like to now show some slides. So can you please help me with the slides? There you can see how we have made it in Sweden. I think this can be one way. We have one center, national center, but and we have a national cancer strategy. Next, please. Next slide, please. So the mission is that we should have a patient-focused and equal and available cancer care. And that is very important because, as I told you, also in member states within the regions, we have different equality. And there you can see that we have now the cancer strategy since 2009. And we have also 6 different regional cancers. Next slide, please. And there you can see the 6 regional cancer centers. Next slide, please. And then we have the regional, next slide, please. We have hello? Hello? Hello?
Okay. Do you hear us?
Please go on. We can hear you. We can hear you.
You can hear me?
Yeah, we can hear you.
Yes? Can you put on the slide?
Don't you see your slide, Birgitta?
No, I don't see the slide.
She doesn't see the slide. Can you fix it? Now you can see?
No.
We are fixing it.
Okay, good.
Okay. So, Birgitta, we are on the slide on AReSS Organization for the Development of Cancer Care. Don't you see it?
No, but nevertheless, I just wanted to give you an example of how we work with this in Sweden, and it's really important that the knowledge goes. There I see it. Yeah.
Okay, good.
Yeah. Now, well, now it's gone. I don't see anything. But nevertheless, we can skip the slides because I want to tell you that it's so important with knowledge that the people that work with the patients, that they are very well informed and that you have a really good knowledge bank for this. So the knowledge goes not only national, should also go regional, and each patient has its own patient plan, and also we have standardized programs, so we know exactly if you have breast cancer, what to do in each step. So I hope that in the whole Europe, this will come true, that you have really good cancer plan for, it's the best knowledge and the best treatments should be presented in this knowledge center. And we'll just conclude that if we should fight against cancer, collaboration is so important, and that's why we have to be dedicated to cooperate, because if we don't cooperate EU, national, regional, and local level, then we cannot defeat cancer. So if we work to collaborate together, I'm sure that that's the way that we can have less cancer cases in Europe. Thank you.